5 things your patients want to know. A few months ago, I attended an event at a local dermatologist, and they were promoting this new microneedling machine in their office. The event was done really well. There were welcome gifts, speakers, food and beverages, and patients there to share about their experience with this procedure. But the actual presentation about the service from the doctor was terrible. I even heard someone in the audience say, "Please don't tell me that." What did this doctor do wrong? My guess is this doctor was repeating the sales pitch from the rep that came into the office to sell him this equipment. He was telling the patients all the things he thought was interesting and important instead of focusing on what was important to the people in the room, the patients. Remember, when a sales rep comes into your practice, their company has spent millions of dollars and hours of training perfecting their product messaging for you, the doctor. They point out the features and the benefits of the product that they know matter to you. They explain the medical research. They focus on why this is a great investment for your practice. They focus on the information you need to make a decision. If you have a good sales rep, you're going to be so excited about all this new information that you've learned, and you're going to want to tell your patients everything you know. Have you ever heard of the term verbal vomit? It's the idea that somebody starts talking and then rambling and then spewing out everything they know. It's a disgusting analogy, I know, but I think you get the picture. Don't verbal vomit on your patients. Instead of telling the audience everything we know, we need to filter out the information, personalize the message, and tell them only the things they care about the most. We don't need to overwhelm the patients with facts and figures and details that we find the most interesting. In fact, this can sometimes talk your patient out of going forward with treatment. In the event that I attended, the doctor started telling the group how many needles were on the device, what they were made out of, and their exact measurement. That's when I heard the person behind me say, "Please don't tell me that." Every patient is going to be a little bit different in what they want to know, how much they want to know, and what's important to them, but here are some questions I consistently hear patients ask and that you should be prepared to answer. You don't need to rush to get a pen and a paper. I'm going to have a free downloadable document with all of these recommendations and questions. Here are the 5 questions that patients want to know before moving forward with treatment. Question 1 is, who is this for? Am I a good fit? If I'm sitting in your audience, I want to know that this is good for me. Should I be doing this procedure or service, or is this for a different type of person? I want validation that this is right for me personally. This is why individual consults are so important. When speaking to a patient, you want to personalize the message rather than just giving them a standard sales pitch. Let me give you a really quick tip for how you can personalize your sales message. Use the word because. A Harvard study in the 70s tested the likelihood that somebody would let a colleague cut in line to use the copier based on how the person asked the question. In this study, compliance jumped from 60% to 93% when the word because was used in the sentence. When people hear the word because, they think, oh, there's a reason for this, and they're more likely to agree. In simple decisions, the reason doesn't even have to be a good reason. According to the study, when no reason was used, compliance was 60% for the percentage of people that allowed others to cut in line to use the copier. When a good reason was used, like because I'm in a rush, compliance jumped to 94%. When a not so good reason was used, like because I need to make copies, which is obvious because you're in line for the copier, compliance still jumped to 93%. The difference between a good reason and a not so good reason was only 1%. Just the word because was enough to increase compliance. But in your situation, it's a big decision, so you want to have compelling and personalized reasons behind your because. You can link the reason to their medical history, their physical features, or even their personal goals that they've shared with you. For example, if you're talking to me, you can say, "Hey, This procedure is a great fit for you because your skin type tends to show the best results. Or, Lauren, this is a great fit for you because you've mentioned that you want your skin to look tighter and more radiant, and that's what this does. Tie in their personal situation and why they're a good candidate. Question 2, does this work? I want to know, how effective is it? Can you show me evidence that it's worth the time and money and energy? The best way to do this is to show testimonials or before and after pictures. Prove to me that it's going to provide meaningful results. Question 3, is it safe? And along the same lines, will it hurt? Patients want to understand the chances of an adverse reaction. Has this been clinically tested and proven to be safe for patients? Especially with a new procedure, patients are nervous that they're the guinea pig and they worry it could be dangerous. Make it clear that this may be new to your practice, but it's been tested and proven to be safe. And if it's going to be uncomfortable or painful, explain the special ways that you can alleviate pain and make the process more bearable. Question 4, how much time will this take, including downtime? People are busy, and they need to understand how much this will interfere with their life and their work. Is there anything you can do to reduce downtime or make this easier for the patient to book? What do you do in your practice to make it an easy process for your patient? Question 5 is, why should I get this done in your office and not just any office that has this machine? This last one is so important. You're selling the patient on the machine or service or product, but you're also selling them on you. If you just focus on selling me that laser, I might go find another practice that uses the same laser but does it for much cheaper. Let them know why you're the best person or best place to receive this service. If you and your staff can present products, procedures, and services with this framework, I guarantee that your patients will move forward with treatment more often. Focusing on what's important to them, not what's important to you, will make your message clear and compelling to the person listening. I know, it can be tough to change what you've always been doing, and it can even be harder to teach your team to change. Don't worry, I'm here to help. You can download my free worksheet that will provide these questions and will walk you through how to answer these questions. This document even includes a bonus question for you to answer. You can print the sheet out as many times as you'd like and create messaging for as many products or services that you need. Go over these questions in a group and brainstorm the best responses, and you'll be on your way to better communication with your patients.